Good afternoon, and thank you for joining us for our third in a series of Lunch and Learn webinars. My name is Megan Liesfeld, and I serve as the Executive Director for United Way of Lincoln and Lancaster County. Today, I'm joined by representatives from 4 of the 41 community-based agencies with which United Way is honored to partner. Each of our guest representatives will have some time to introduce themselves and their organizations in just a moment. But before we begin, I want to provide just a bit of context for our conversation today. Mia is going to be shortly sharing a slide that illustrates the priority areas through which United Way invests donor support into our partner organizations, and in turn, those in our community with whom they work. As you can see, the 3 primary focus areas of United Way are education, income, and health. Today, we're going to be talking about the work that is being done within the health pillar, which focuses specifically on child and family well-being. Over the next hour, you will have the opportunity to hear more about the important work being done through behavioral health programs for youth, child safety, and supports for victims of domestic and intimate partner violence. I'm so grateful for the opportunity to hear from the agency representatives that have joined us today, and for you all to have the chance to ask questions and get to know more about the important work they're doing in our community. As we move through the conversation today, please go ahead and put any questions for our guest speakers into the Q&A box, and we will ask those at the end of our roundtable discussion. I want to start with our introductions and would ask Paige if you would please start us off with an introduction of yourself and your organization.
Hi, my name is Paige Piper, and I'm the Executive Director of the Child Advocacy Center. I'm the newest director of this group. I just started on June 1st, so I'm excited to be here and to have the opportunity to share more about the CAC.
Thank you, Paige, and welcome. Amy. And Amy, I think you're on mute, so we can't hear you yet.
Okay. All right. That's my first challenge. I'm Amy Evans. I'm Friendship Home's Executive Director. Friendship Home empowers freedom from domestic violence for more than 1,500 victims of domestic violence each year in Lincoln and Lancaster County. And we do that by providing emergency shelter and transitional housing and crisis services. And it is our emergency shelter and crisis services that are supported by United Way funding. Most of the victims we serve are women and children, but we do serve male victims of domestic violence as well.
Thank you, Amy. Katie.
Hi, good afternoon. I'm Katie McLeese Stevenson, and I serve as the Executive Director of HopeSpoke. And our mission at HopeSpoke is to inspire healthy futures for children and their families through comprehensive behavioral and mental health services. And last year, we had the good fortune to serve over 1,500 individuals in our community. And the United Way helps provide support to 2 of our programs. One is our outpatient services program that we offer at 2444 O Street. And then the other is in our outpatient schools program, where we are co-located in 25 of Lincoln's public schools.
Thank you, Katie. And Linda.
Hi, my name's Linda Dubbs-Turney, and I'm the Assistant Vice President of Children's Services at Lutheran Family Services. We're very happy to receive support through the United Way for our children's behavioral health programs. And we are guided through our vision of safety, hope, and well-being for all people, with a mission of expressing God's love for all people by providing quality human care services that build and strengthen individual, family, and community life. Thank you very much for asking me to be part of this panel.
Thank you all. Really appreciate those introductions. And as we dive into our questions, I really look forward to learning a little bit more about what's happening within each of your organizations. We're obviously in a bit of a unique time in our community, in our country. And a great deal has likely changed for you all organizationally in the way that you approach your service to the community. So this first question, you are welcome to address in any way that you like, whether that's just kind of thinking about changes that have occurred in this last year, last 9 months to a year, or even just over time. But our first question for each of you is, what opportunities have you seen in your programs to better or differently serve the program participants who come to you for support? And we're going to start off with Paige.
Well, there's a number of ways that we've really focused on being able to serve our populations differently. And it's no secret that COVID has had an extreme impact on everyone in our country, in the world, let alone the vulnerable populations that we were already seeing at each of our respective agencies. So I'm going to answer this not COVID specific, but just looking at the various ways that we've been a bit innovative in the past year to continue to serve children and families in interesting and unique ways, and meeting the needs of our community. The Child Advocacy Center has been around for 22 years, and we work directly with child victims of abuse. About 75% of the children that we see are coming for allegations of sexual assault, followed by physical abuse, serious neglect. We serve children who have witnessed a violent crime like a homicide, children who have been recovered from sex trafficking, which is something that's relatively new. And we've had to really educate ourselves on what services look like for those kiddos. And our services are enacted through a variety of ways, from being able to provide a forensic interview so that they don't have to tell their story directly to law enforcement, providing advocacy through the entirety of the case, including if it becomes court involved. And that advocacy component is truly the heartbeat of our agency. And that's what United Way chooses to support and has for many, many years. Over time, we've begun to realize that the CAC responds to the immediate crisis. We're helping children and families during their darkest days, but sometimes what we miss out on is figuring out ways that we can be more of a preventative resource, as well as following up on the aftermath of abuse. So we've put a lot of time and research recently into our training and prevention program, and have strong hopes over the next several years to increase our training and prevention efforts. I know, Katie, you mentioned that you're co-located in the schools. We need to talk about how to do that because that's a huge area that we have the opportunity to serve children who may come through our center at some point, by letting them know what resources are available to them, and that there are people who are there to support them if there's difficulties, whether that be within their home or in an activity, wherever they may be experiencing that instability or abuse. We've also really leaned into adverse childhood experience research, so ACE score studies, if anyone is familiar with that. And that's really stemmed off of work by Dr. Nadine Burke-Harris that takes a hard look at 10 different factors that can happen before a child turns 18. And those 10 factors actually have significant implications for the rest of their life, all the way to decreasing their lifespan by potentially 10 years. So the good news with that is that kiddos are resilient. And if that trauma is addressed early on, there's a strong chance that they will lead a perfectly normal life. And we know at the Child Advocacy Center that most of the time when children and families are coming to us, there's not just one reason. Oftentimes there's 3 or 4 reasons, and you start peeling back those layers, and we learn that there's domestic violence in the household, and we're contacting Friendship Home, or we're learning about, alcoholism or mental illness, or all of these different factors that provide this comorbidity for these children and families that we're serving, and we recognize the impact on their mental health. So another key area that we've spent a lot of time focusing on, and to be a bit more innovative, is on our mental health services. We have Lutheran Family Services in our building and Project Safe, and our services would not be possible without these entities. And we're very interested in continuing to grow our partnerships. The last thing that I'll mention, and I mentioned this briefly at the beginning, is the sex trafficking victims. It's not new that that's happening, but it's relatively new that we're serving them at a significantly higher rate than ever before. There's been a lot of statewide initiatives that have focused on trafficking victims, and more we're seeing kiddos walk through our door who have unfortunately experienced trafficking. It's a very complex population to serve. That trauma is so deeply rooted. It can be very, very difficult to figure out how to meet their basic needs, let alone try to start figuring out how do we combat some of this mental health and all of that trauma over time. So I don't know if I'm allowed to say this, so this might be my first debut. We'll see if I get a slap on the wrist. We're partnering with a couple of different agencies, and we will actually, hopefully in the next few months, be bringing on someone exclusively to help partner with law enforcement, health and human services, and the multiple entities that respond to sex trafficking to coordinate what we're calling a CSEC team, childhood sexual exploitation team.
Thank you, Paige. I really appreciate you sharing that great information. Next is Linda. Linda, would you share with us a little bit about the opportunities that you've seen in your programs to better or differently serve those that are coming to you for support?
The world changed in March of 2020, as we all know, with COVID rearing kind of its ugly head. One of the things that was very interesting that happened over at Lutheran is we had dipped our toe in the water with telehealth and had about 5 telehealth rooms. And to date, we have 65 rooms. So what we've seen is an increase in serving people across the state. So no longer is location a barrier. And so that's been very encouraging. Like I said, we serve people across the state, not just more in the eastern part of the state. It's required all of our organizations to be very flexible and very nimble in order to continue to meet the needs of the people. One of the things that came up with the children's therapists, I'll speak to that a little bit more, is, gosh, how are we going to continue to provide some of those evidence-based treatments in this virtual world? So one of the things we were able to do is contact international and national model developers, and we're able to secure some advanced training so we could continue to do that. And one of the things that we thought was very interesting is in our PCIT, parent-child interaction therapy, which is one of the kind of gold star evidence-based treatments. There were many parents that were saying, gosh, we really like this because it's done with a kind of a bug in the ear. And so we were able to do that on telehealth with some modifications. So that's been very encouraging. For some families, they've not had to load up their kids and come to the office. So while it's not been the preferred method for some people, it really has worked really well for others. I think along with this, there's been a lot of communication with community partners, problem solving. How do we make this work? We are still primarily virtual. We have begun to provide a few in-person services for behavioral health in circumstances that require it. I think the other things that have happened, Lutheran Family Services has been the recipient of some CARES Act money, which we've been able to provide housing and some other emergency assistance to people statewide, as well as some assistance with technology. So that's been helpful. It is an unprecedented time. I think the key to a lot of this is continuing to work together as agencies and support each other.
Thank you, Linda. Katie, would you share with us opportunities that you've seen within your agency and your programs to serve differently or better?
Happy to do so. At HopeSpoke, we've got a bit of a mix of how we're offering services. So most of our services really haven't changed too much. Our therapeutic group home continues 24 hours a day, 7 days a week on site. Our extended day treatment program for 5 to 12-year-olds continues Monday through Friday on site, and as well as our services at the detention center continue on site, and our school-based therapists are in the schools on site. As Linda mentioned, our outpatient therapy program has moved to telehealth, and we have telehealth opportunities at those other programs as needed. And we hadn't quite yet dipped our toe into the water of telehealth before the pandemic started. And we were, it was in our strategic plan, and it was something we'd been thinking about and talking about. But I share with people that we did in 5 days what would have taken us 5 months or 5 years to make happen. And so we very quickly all became telehealth experts as well as epidemiologists. And so it's been a really, really fascinating time. And just in the time between the 23rd of March and the 30th of June, we offered, I believe, over 3,500 sessions through telehealth for those that we're working with. So our outpatient services are pretty much all telehealth still. We're waiting for our return to work plan for our clients and our staff to be based on the risk dial in the community and where we're at with that. And I think we have seen that some people really enjoy telehealth, prefer it. It's easier than loading up all the kids and coming across town. Some folks have, transportation issues. They have multiple children, they have multiple jobs. It's just a lot to make happen. And so it eases some of those issues. There are complexities to it. And when you're serving minor children, there has to be a responsible adult in the household so that there's a safety plan if something happens during a session. So certainly there's different aspects to it. But one of the things that we've seen improvement in is our no-show rate. If someone doesn't come on for their session, you just pick up the phone and call them. They say, "Oh my gosh, I forgot," and they can start the session with you versus needing to drive across town or having a flat tire, those kinds of things. So that's been a real positive. And I think one of the other opportunities here, we have been a trauma-based and trauma-informed agency for many years. And I think the pandemic is giving us a new way to look at that because it's giving really all of us some level of trauma that we're experiencing. And so really having sensitivity to how people are doing. And we're seeing a lot of individuals come to our agency that have never before sought mental health services. And this is really a new experience for them. We also have a CARES grant, and we're providing some basic need assistance to folks. And we're seeing people that have never asked for assistance step forward, and that can be really difficult. So trying to know that everyone, including our staff, are experiencing some level of trauma and how we can best support and provide care to them as well.
Thank you, Katie. Amy, what opportunities have you seen within your programs?
Thank you. For a number of years now, Friendship Home has been providing the bulk of our emergency and transitional shelter through single-family apartments scattered throughout the community. And in that model, we send services into families. They live independently, and we're sending advocacy services and supplies and food into them. So this model has really actually been ideally suited to help us weather a pandemic. Families are already in their own environment. But we've certainly had to adapt and I think our staff has been really creative in finding ways to support families out in the community. So, for instance, we've switched our face-to-face advocacy to advocacy over the telephone. We have set up workstations for women who suddenly find themselves telecommuting, and remote learning stations for children who are now learning from home. Our children's advocates have been really adept at helping reduce the isolation for children. So, for instance, when they used to be able to do face-to-face services with children, and now they're doing creative things like packing up a baking kit for families and taking it out to their doorstep so that families can bake together. They've delivered bikes that have been donated to families so that children have the opportunity to be out and active with their family. They've instituted phone calls with children. They make an appointment with the children and have wonderful, deep conversations. They've been using a book called 3,000 Questions About Me, and used as an opportunity to kind of structure a conversation with children about how they see the world and what matters to them. So we have children really looking forward to that chat with a children's advocate on a regular basis. What's interesting, though, for me about this process of adapting is that it's not a big stretch for us. Because it's really a part and parcel of what we do in domestic violence shelter. Batterers do more than hit. In fact, they systematically undermine all aspects of well-being in their victims' lives. So they are controlling their victims, for instance. They are isolating them from family and friends. They're withholding access to money. They're restricting access to health care because they don't want anybody to see too much about what's going on in that family. They're undermining the victim's sense of self and of self-efficacy. So when victims reach out for shelter, when they come into shelter, they are doing more than escaping violence. They're rebuilding their lives. And so at Friendship Home, that's one of the aspects of what we do in shelter is we recognize that Paige used the word peeling back the layers, the term peeling back the layers, and it's really what we're doing. We're recognizing that in order for families to find the firm footing that they need to move out of violence, we have to look at all aspects of well-being in their lives. So we're very accustomed to that kind of individualization. What does this family need? How can we help them with their goals? So as we respond to a pandemic, what I can say is that a pandemic is a significant barrier for families that we're serving, but it's just one of many that they have. Our advocates and case managers at Friendship Home are so good at working with each family to surmount those barriers.
Thank you, Amy. I appreciate that perspective. Next question that we have for our panelists is, how have the people that your organization serves through your United Way funded program been impacted? We've already started to talk a little bit about this, but how have they been impacted by the challenges our community has faced over the last 7 months? What has been unique or different as it relates to just their needs?
So,
okay, let's start with
Linda.
Linda.
I think I'm first. So I think, as many of the panelists have alluded to, it is a unprecedented time in providing services. I certainly have never been through something like this in my lifetime. We figure that in looking at the people who come to us for services, about 90 to 95 have some previous trauma. And then when then you add the impact of the pandemic, that certainly has had an impact on families and children. And as Katie alluded to, and I think probably all the panelists, it's adding another trauma, another stress to families. Families and people are perhaps more isolated. And we worry about things like, and I don't want to get to the next question, but we also worry about things like domestic violence and child abuse and so on and so forth. I think that, we look at the social determinants, financial stability, housing, transportation, food, childcare, and medical care. We know that people are stressed to begin with, and then to have the barriers that we have right now, that's certainly concerning. I've seen agencies and private donors really come forward and offer assistance and help, and truly seen the kindness from communities and other organizations. So that's been very endearing. I think that one of the areas, as you know, Lutheran Family Services had a large refugee resettlement program. So we also know that there's been impact on some of our new populations, or even looking at people of color and the health and social longstanding inequities and how those may be impacting the communities. So I guess that's more of a lot of concerns that I voiced, but things that we've tried to be aware of and be creative and reach out to communities to try and help. So anyway, I think the last thing is that, just in following the information on the pandemic and the CDC and the health departments, we do know that people who have had issues with like food insecurity, access to health, we know that they're also more likely to get sick and die of COVID. So those are the things that we all try to take into consideration when we look at serving the community and how we can reach the most vulnerable populations.
Thank you, Linda. Amy, you've talked a little bit about this, but share a little bit more with us, if you would, just about how the people your organization serves have been impacted by the current challenges.
Like most of us, they've been impacted by jobs, income, childcare issues. We know that domestic violence compounds that impact for them with all the barriers that they're experienced. It's increased battered women's barriers to safety. We know that there's probably more domestic violence going on right now. It's typical that batterers will increase their violence when they experience a decrease or loss of control, in other aspects of their lives. So if their jobs, are insecure or have changed in a way that's uncomfortable, if there's income insecurity, it's likely that there's more violence, as batters attempt to establish control of their victims, if they can't control other aspects of their lives. So it's very concerning, to know that there are women who are trapped, at home with their batterers, and experiencing such strong barriers to safety. If their batterer is working from home, they're likely at home with them all the time, and that kind of unrelenting violence or threat of violence and control can take a huge impact, even greater impact on victims' sense of well-being, their emotional health. So we did see a decrease in requests for shelter initially last March and April and May, and that's typical during times of a national crisis or natural disaster, that requests for shelter go down. We would expect that as things return to more normal, that we will see a flood of requests for shelter in response. So things have rebounded a little bit. We're almost back to normal in terms of requests for shelter, but we would expect to see again that flood once we get back to a more normal world. Leaving doesn't end the violence. And I think that's maybe one thing that people tend not to understand. Why doesn't she just leave is the question we hear often. But in reality, leaving doesn't end the violence. Batters escalate their violence in an attempt to bring their victim back into the relationship, to be coercive. And so battered women are at a much higher risk of being killed or seriously injured at the time they're trying to leave the relationship. And so that's why shelter is so important. It's not that people need a place to stay so much as that they need a safe place to stay against that escalating violence. So leaving is frightening. Battered women often hear, if you leave, I will kill you. I will take the children and leave, and you'll never see them again. There are so many ways that batterers discourage women from leaving. So sheltering is really a sacred trust with victims, to be there for them, to be responsive to their needs, to help keep them safe. So it's no wonder, that when they're already experiencing so many barriers to safety, that launching their children and themselves out into a world where a virus is killing people is terrifying. If staying is untenable and terribly frightening, it's terrifying to think about leaving as well. So, at Friendship Home, we're doing a lot of telephone advocacy. We're working with women around how to stay safer in their home until it feels like that it feels like the right time to try to leave.
A sobering reality.
Yes.
I appreciate you sharing with me. It's important for all of us to continue to be aware that needs exist. That the realities aren't always something we can see in front of us, but they're there. So thank you. Katie, would you share with us a little bit about the needs that you're seeing?
Sure, happy to do so. I was just thinking about our 4 agencies and how there's some intersection, certainly, of individuals that we're working with. And I think about kind of a Venn diagram. And so we have child abuse, we have domestic violence, and we have mental health and substance abuse. And then in the middle of that, there's often some overlap. And so at one time or another, one of those issues might present as the most immediate, or it might be the lens that one of our agencies is working from. But even though our expertise is not domestic violence, we know that that's a huge contributing factor in some of our families' lives. And so we try to learn about that and partner with Friendship Home and other agencies to do our best in those areas. But what I think we're seeing from a mental health and substance abuse perspective is increased need. We are seeing, for the individuals that we are already working with, people who already are dealing with anxiety, depression, and other issues, that their symptoms are exacerbated. If you're already an anxious person, you're more anxious given the pandemic. Similarly with depression. But I think what I mentioned earlier is we are seeing perhaps a whole new group of individuals who have never sought services, that are finding that their daily living is so disruptive right now that they need some assistance. And so I think of that as both the difficulty and the silver lining, maybe with the pandemic, is that perhaps we're more willing to reach out for things that we need because we're at a crisis level. And we know that we're more responsive when any of us are in a crisis situation to perhaps change. And so people who have significant mental health needs or substance use needs are reaching out in a different way. People who are involved in child abuse are reaching out, or domestic violence. So, I think we've all seen the statistics about the increase in alcohol sales, and some people kind of snicker at that and talk about, how they're getting through the pandemic. But if you are an individual that really struggles with substance use dependency, this is a perfect storm in terms of further isolation, disruption to your social supports, all of those kinds of things. Many individuals use substances, whether it's legal or illegal, to numb the pain. And may not have a detected mental health condition at that point, but may be using alcohol or drugs, again, legal or illegal, to help take away that pain and numb that. So I think we are seeing both for the people we serve a deeper need, and then for those that we haven't served before, an expanding need in the community. And, right now we have waiting lists for all of our programs.
Thank you, Katie. Paige, would you please share a little bit with us about the specific challenges that you're seeing?
Absolutely. It's been really interesting over the past 7 months to see, just like Katie and Linda and Amy have shared, just the drastic impact that we've seen on the population that we serve. And early on in March, April, and May, when everything sort of shut down, I remember being at work on Friday the 13th, and then I didn't go back. And it was almost as if when that happened and the entire world sort of closed, it seemed like for a split second that all of these issues went away, in a sense, with it, because the child abuse and neglect hotline reports dropped by over 50%. And initially it was this, wow, kids are home, what's going on? But there's a lot of research that's pointing now to that was an incorrect perspective to have, because we know that home is often not a safe place for children. And in fact, the most common reporter of child abuse and neglect are teachers. And so what happened is we removed children from school where they had a safe and trusted adult and put them in a household with mounting tensions between, economic recession and job losses and trying to figure out how to homeschool while working full time. We watched how all of these issues started to mount over time. And unfortunately, it's having a devastating impact on children. They lost food security. Oftentimes, children's meals for the day happen at school. And now they're in a household where there's so much instability, along with most child abuse happens at home, or the perpetrator has access to that home. And so now they're home alone all day with someone who may be hurting them. And I know it's something that we don't want to talk about and we don't want to lean into, because it's so devastating when we think about that. But it's also so important that we allow ourselves to go there. When COVID reports dropped, obviously our numbers, or not COVID reports, child abuse reports during COVID dropped. Obviously our numbers at the Child Advocacy Center followed. And so we were seeing far less children. But simultaneously, the kids that we were seeing, the severity of the issues were so extreme. And it mirrored what we were seeing in the emergency rooms. The reporting was down with the hotline. However, emergency room reports almost quadrupled in March, April, and May, because child abuse was so severe that physicians were calling and saying, I don't know what's happening, but this is what I suspect. Also around that time, RAIN, the national hotline for sexual abuse, more children called the RAIN hotline for the first time in history than adults. So children began seeking out these resources for themselves. And while that's so devastating to hear, it's also so encouraging because children are learning how to be self-advocates as well. Not that they should have to be, but there's a lot of power in being able to run a quick Google search and finding out that there are resources available to you. Now that the world has started to open back up in some respects, and we have children back in schools, we're starting to see the floodgates open. We're serving the children that we should have seen in March, April, May, June, July. Our current active caseload, it was interesting, right before this call, our lead advocate sent me our current numbers. We have 320 active cases. Now, to give that some perspective, the average should be about 40 to 50 per advocate. We have 4 advocates with 320 cases, and one of them is also supervising. That means that some of our advocates are carrying caseloads of 90 plus. That's an extreme number that we're trying to balance. And it goes back to the reason that this United Way funding is so mission critical for us, is that advocacy program is not just day of. It's not just happening when children walk through our doors. We're continuing through that court process, which can take months, if not years. And of those 320 cases we have right now, over 100 of them are court involved. So our advocates are really burning the candle at both ends. But we know that this is not going to slow down anytime soon. You know, that just as you're seeing more and more in every agency, we're following suit with that. And we know that, you know, while we focus so much on quantity, the number of individuals we're serving, really it's the severity too. And I think that, you know, we will continue to deal with the aftermath of COVID for years to come.
Thank you, Paige. And I want you all to know, before we move into our next question, that we do have a number of questions that have been submitted, and one of those is how can we help? So we will get to that here in just a moment, but I do want to ask one more 2-part question of each of you. And we'll start with Katie this time if we can. But Katie, would you share a little bit with us about, first of all, what is keeping you up at night? But then secondarily, and I think an important place to end our conversations today is what's giving you hope at the same time. I know that all of you do this work because you have hope and you maintain hope even in hard days. So if you would start with letting us know what's still keeping you up at night and what worries you, but then end with what's giving you hope.
Sure. What's keeping me up at night? Well, there's a couple things. And I think one of those is safety. And how do we balance the need for safety for our clients and our staff, and physical safety, psychological safety? And it's, we know, and you've heard, I think, from all 4 of us, how incredibly difficult the issues are that people are going through right now in our community. And so more than anything, we want to be there and be available and be of service. But at the same time, with those of our services that we're offering face-to-face right now, how do we keep everybody safe? How do we keep our clients safe? How do we keep our staff safe? And how do we keep the community safe? And so that's something that we're working on all the time and talking about. And I think the psychological safety is an important part of that. And I think a lot about that in the work that we do, right? We don't make widgets. We're not making a product. Our method to do so is ourselves. And so how do we help our staff to stay as healthy as they can and to do the self-care that they need during just a really difficult time? So that's one thing that keeps me up. The other thing that keeps me up is those individuals that are on our waiting lists that we haven't reached yet. And how do we best wrap our arms around them and do what we can until we're able to serve them more fully. So that's another thing I think about. What gives me hope or joy? This was mentioned earlier, and resilience. of those that we serve. I think that I think all individuals are resilient, but I think children are particularly resilient. And sometimes they don't have the cynicism, maybe, that some adults have developed in time. And so that's really, it's really wonderful to see the growth and the joy and the light return. I've also felt hope from the outreach from our community and from individuals who, even though they may be experiencing some financial instability, are willing to help and be supportive during these really difficult times.
Thank you, Katie. Amy, would you be willing to share with us what is keeping you up at night and what gives you hope?
Sure. Thank you. Our waiting list for shelter is what keeps me awake at night. On an average day, there are 38 children, women and children, waiting for safe shelter at Friendship Home on an average day. They're waiting for safe shelter from violence in their home, which is a real concern. What we know is that victims don't reach out casually for shelter. They've often thought about it for a really long time. It's a grave decision to make, to leave your home and leave most of what you own behind, to risk that escalating violence that happens at the time you leave. And when they reach out for shelter, what they need is safe shelter. What we can offer them now is some really robust pre-shelter services. So we're providing crisis counseling and safety planning and lethality assessment and case management and financial aid and support groups and all kinds of really robust services for them while they wait. But in fact, what they need is emergency shelter when they're reaching out. And we just don't have enough in this community. We have 85 emergency shelter beds, but we need 125 to meet the need in this community. And it's such a concern that the individuals we're serving will be hurt while they're waiting for shelter. We all worry. We're going to open the paper every morning. Those of us who work at Friendship Home, we open the paper with some trepidation every day. Has someone lost their life because of domestic violence? Because batterers can be lethal. So that does keep me awake. Like Katie, I also spend a lot of time thinking about how we keep our staff safe and support their well-being through this process, because this has been tremendously stressful for everyone. I think that's it. It's generally how to support more shelter beds so that women and children have access to the life-saving services that we can provide at Friendship Home. In terms of hope, I spend a day in a domestic violence shelter and it will break your heart. It's true that we see the worst of humanity every day, sometimes on an hourly basis. What batterers do to women and children is just unspeakable. It's happening all across our community and every neighborhood. It's happening all across our nation and across the world. But in reality, we get to see the best of humanity as well. And that's what keeps me going. We see the resilience and the courage and the generosity in the people that we're serving. We see them changing their lives and then reaching out to help others do the same. I have the privilege to work with this amazing team of women and men at Friendship Home on staff who are so committed and creative and just remarkable contributors to our mission. They inspire me every day. I've had the opportunity to work with Friendship Home's Board of Directors since 1988. So I've had this kind of long vision, this long view in terms of how a board of directors can pass an organization forward into the future. year by year, making it better, making it stronger, supporting it. So that has just been so inspiring for me, to work with board members who are committed and caring and talented, and who bring their talent to our mission. That's been an amazing experience. And it does keep me going. And overall, like Katie mentioned, I see the generosity of this community. And it just amazes me. It takes my breath away sometimes, because the women and children who are sleeping under a homemade quilt don't necessarily know that was made by a quilting group in Lincoln. The bicycles that were delivered by our children's advocates, they don't necessarily know the donor, or donors that made sure that they had those bikes so they could be out and active. But certainly there they are for them. They don't recognize that the meals that are on the table necessarily are provided by people in our community who have their backs, who really care about them, and want to see them move out of violence and rebuild their lives. And I see United Way as just an amazing example of that. Of our caring community. Friendship Home has received support, has partnered with United Way since I think about 1983. So for many, many years, we have the people that we serve have benefited from United Way's work in this community and from the generous donors who've made that possible. So as I think of it, I like to think of it in terms of children sleeping safely at night. That generations of children have put their heads on safe pillows, been safe in bed at night, as opposed to hearing violence in their home, as opposed to hearing mommy crying or screaming, as opposed to hearing yelling, that kind of pain that often happens at night when it's dark and scary. I think of children sleeping peacefully in their bed at night in a home that is safe for them. So that gives me hope.
Thank you, Amy. Linda, would you share with us what is keeping you up at night and also what's giving you hope?
Well, some of the panelists have already spoken about this. Katie was talking about staff and that balance between serving people and taking care of staff. That is really difficult in a time, in our time now, because many of the staff have their own challenges, as we have said, in maybe homeschooling or taking care of their own family. And then trying to be flexible and nimble enough to provide for our children's behavioral health clinicians services to other families. We also have a number of other services, as you likely know, our foster care program, adoption, and one of the other things that has happened at Lutheran Family Services is that we did receive funding for a certified community behavioral health clinic to be able to serve families. So that being said, there's just a lot of moving parts, a lot of things going on at LFS. But the things that do keep me up at night is how do we continue to serve people and meet their needs, especially moving into the winter months with more isolation possible. We look at the impact of just seasonal flu on the current pandemic, and what does that really mean? I think one lesson we've probably all learned is that we have to be flexible, and the information can change from day to day. We were kind of laughing at work that we were looking at some of our early emails and communications when the pandemic started, and kind of laughed at it as far as, wow, where were we then and where are we now? So, and I think, we've all alluded to that many of the people we serve and the families we serve are some of the most vulnerable. So, I think that speaks for itself. The hope And what gives me hope is how flexible and nimble the organizations have been. I've seen that at Lutheran. I've seen us really move forward in reminding people that there's support when you're serving the people who come to you. We've been given some extra days off, like a couple extra days just for mental health. Encourage you to take or to ask for flexible work schedules, and just trying to make sure that people are taking care of themselves. So that gives me a lot of hope. And as many other people have said, the generosity of the community and the kindness of the people in our community speaks volumes. That gives me a lot of hope. I think that also, not to go off course here, but I think a lot of the agencies and organizations have been flexible and creative in figuring out how do we serve people, and that flexibility and gives me hope that we'll continue to work together and we'll continue to figure out how we can best meet people's needs in our communities.
Thank you, Linda. Paige, in the time we have remaining, which I should have been paying closer attention. We are at 4 minutes left of our hour. It has flown by. But I want to make sure that you have an opportunity to share. And then for those who have asked questions, just know we'll work to get answers to your questions as well, and get those back out to you. But before we conclude, Paige, would you share with us what is keeping you up at night? And then what is giving you hope?
Sure. I'll be very fast in the interest of getting to these questions. Ditto. I would say everything that's been shared. What's keeping me up? It's the children that we're not seeing. It's the ones who are at home, who don't know what resources are available to them, who don't have a trusted adult to talk to. That is forever what will keep me up. Along with, honestly, just figuring out how to not burn out my team. With our caseloads rising so significantly, it's just, as many of you mentioned, how do you balance keeping them mentally healthy and well to be able to serve the kids and families that we're seeing, combined with all of the stressors that they have in their personal lives with this pandemic and their own children and families, or ill parents. It's a laundry list of stressors, while also trying to care for our most vulnerable population. What gives me hope is that children are resilient. And I think the perfect example of this is I have a note on my desk that was mailed to us about 2 weeks ago from a child who addressed it to the Child Advocacy, with a T in it, Center, which is just the sweetest thing, that says, "Thank you for listening to me and believing me. You saved me."
That certainly is I think, an important and a powerful statement. Thank you for sharing that. In just these last couple of minutes, and I apologize, we are not going to get to all of the questions, but we'll reach back out to those who had questions, which are predominantly in the area of how do we support you all. What can you use beyond financial support? So we'll get that information back out. But I just want to say how incredibly grateful I am for all of you. Your perseverance through what is an extremely challenging time. Your empathy for those in our community who come to you for support is so admirable. And I'm just grateful that you all have continued to live out your missions in what is just an extremely challenging environment. So thank you. Thank you for taking time to share with us today. I know your time is precious and valuable, and but I know that those who had the opportunity to come on and listen to you all talk about how things are in your programs with your program recipients right now are really grateful as well for the opportunity to learn more So thank you again. Thank you for your service. Thank you for your leadership. And appreciate you and all that you're doing and all that you've been doing in the years ahead of this year. This is not new service. It's just new ways of doing your work. So with that, I will sign us off. It is 1 o'clock, and thank you so much to all who joined us today. We do have one more health conversation coming up, and that is with our CHAD partner agencies as well. So please look at the website and Facebook if you'd like to connect to learn a little bit more about those health agencies in the coming month. Thanks so much.